My name is Jessica Alvarez. I'm an assistant professor in the Division of Endocrinology, Metabolism, and Lipids at Emory University. Broadly, my research interest is nutrition and how it influences metabolism in chronic diseases. More specifically, my research is focused on nutrition in cystic fibrosis. My research interest in cystic fibrosis has sort of taken a circular route. I was first introduced to CF during a pediatric dietetic internship, and I was completely amazed at the interdisciplinary aspect of CF care and how important nutrition was in these children with cystic fibrosis. As fate would have it, when I was interviewing for postdocs, I met Vintang Precha at Emory University, who had just received a large multi-center grant to study vitamin D in cystic fibrosis, in adults with cystic fibrosis. So I decided to team up with Dr. Tang Precha, and I have been studying nutrition in CF adults since then. Over the last several years, with the CF Center, we've realized how important the non-pulmonary complications of CF will become as CF life improves and age expectancy increases. So we recently worked together with Augusta University, Georgia Tech, Emory, Children's Hospital of Atlanta to put together a large center grant funded by the National Institutes of Health, which we call the Georgia CF Center. We are really excited about the Georgia CF Center. Some of the issues that we will address, the non-pulmonary issues that we'll address, are diabetes, issues with GI and liver disease, nutrition and body composition, lifestyle behaviors such as diet, what we eat, exercise, and sleep. All of our core activities with the diabetes, GI, and nutrition core and the lifestyles and behaviors core are centered around this partnership that we have with our patient CF population. So we are inviting participants with CF to come into our research units so that we can perform oral glucose tolerance tests, so that we can do lifestyle and behavior assessments, such as collect dietary information, exercise information, and really we want to work with our patient population to develop this warehouse, this repository of information that investigators can come in and study CF health. We used to think of CF as a pediatric lung disease. Therapies have advanced so much over the last several decades. We are able to start to think about how our patients with CF will age. As our population with CF ages, we have to start thinking about non-pulmonary issues such as cystic fibrosis-related diabetes, such as liver disease, bone disease, all of these things that will influence our quality of life as we age and that are becoming more prominent in the older populations with cystic fibrosis. And so our new center, our Georgia CF Center, Core Center, is addressing all of these issues, not just in pediatrics, but also in adults with cystic fibrosis. Over the years, as we've tried to build these non-pulmonary research avenue in cystic fibrosis, it's really taken a lot of support from the community to be able to start to do that. And with that, we've been able to grow it into a nationally funded core center. I am so excited about the future of the CF program and in helping to improve the quality of life of our CF population.